I started here at Griffin Hospital in 1979. I was a sophomore in the Health Services Administration program at Quinnipiac. I was given the opportunity to do a project here in the Human Resources Department. I guess the folks here thought I did a pretty good job and invited me back to do a series of projects during my undergraduate experience at Quinnipiac. And then I went on to graduate school. Then upon graduation, I actually came on staff here and stayed at Griffin for my entire career, and I became CEO here in 1998.
Pat has really been instrumental in Griffin's transformation. Years ago, Griffin was not thought of as a place that you would go if you need important healthcare services.
I asked a representative sample of community residents, what is your first, second, and third choice hospital? Unfortunately, very few selected us, and 1/3 said that they would avoid Griffin.
That's changed today. If you talk to those same folks, people trust Griffin and people know that this is a place where they can get high quality care from compassionate caregivers. And a lot of that really started when we brought Planetree to the hospital.
Planetree's mission has always been to look at everything from the patient's perspective and to try to improve the patient experience by looking at those human needs. Pat's done a wonderful job of creating an environment around that framework and those principles.
Hospitals and hospital providers typically substitute their judgment for the judgment of patients and never bother to ask patients what they want. We did that.
The healthcare industry is going through a really transformative time. We are no longer just a hospital. We're transforming ourselves to become a health leader. Pat has been really instrumental in helping to shape that vision.
One of the things that makes Pat a very effective leader is the fact that he is willing to listen. He's out and about in the hospital talking to people, listening to what they have to say, and then using that information to continuously improve the experience of either receiving care or delivering care.
Quinnipiac has had a really tremendous influence on me. Frankly, I wouldn't have had the career that I had if it wasn't for those in the hospital administration program who actually arranged for my first field placement here at Griffin. I think that's something that Quinnipiac does, takes a personal interest in its students, and that's made a difference for me.